Hi, I am Dr. Christina Bukaty of Bukaty Family Chiropractic. I am happily married. I have 2 small boys and a daughter. I have been in practice for over 15 years. The things that we offer at our office are chiropractic, spinal decompression, nutrition with supplements, spinal rehabilitation, and massage therapy. When you come into our office for your first visit, you will meet Sue, our office manager. She will make sure that your paperwork is all done, and then she will bring you into our consultation room. In our consultation room, she will ask you some questions. She will bring you into our exam room where you'll be giving a nerve scan, which is something that'll print out something like this, so it goes over how it determines if your nervous system is functioning, how it is functioning, and what is the problem. If there's x-rays necessary, I will be in there to take those. The later part of the exam is when you come in here again, after coming into this room, I ask you some further questions. Depending on whether it's workers' comp or no fault, that's a more detailed exam. If it is under a private insurance, there are certain forms that may need to be filled out. An example of Empire or Aetna. Other than that, we perform the consultation exam between these 2 rooms. And at that time, I determine what care is necessary. You will be getting adjusted. I determine that if it'll be today or at the next visit. If we need to do heat or ice, or at what point will we recommend spinal rehabilitation. At your second visit, you'll be brought back into this room. You'll be watching a short video that explains your report of findings. At that time, I will go over some other sheets, and that's where I will discuss what happens in our office. The philosophy of this office is that you start off with an acute care program of about 6 to 12 weeks, consisting of 1, 2 to 3 times a week. I make those recommendations, and usually the patients consist of that. At that time, you go into a transitional area, which is where your body is now stabilizing. That's usually a visit of 1 to 2 times a week for a couple weeks. Now, 80% of my practice is maintenance. It is once a month or once every 6 weeks. At the time, that's where you are preventing further injury, you're stabilized, maintenance care. It's where you're not really hurting or anything. You just realize maybe you just don't feel right, and that's what most patients choose. That is the best benefit that chiropractic was meant to have. Now, in our office too, your nervous system is the master system of the body. It controls all other systems. Your nervous system controls everything. It controls the other 10 systems. What I mean by that, it controls your cardiovascular system, your respiratory system, endocrine system, bladder, respiratory, all those major systems. So you will notice every time you get adjusted, it is actually improving your overall health. Patients come in and they report that they're sleeping better, feeling better, bowels are moving better. Things like that makes a difference in your life, that makes a difference in your household. Understand chiropractic was meant to be a true healthcare system, and that it helps you from the inside out, and you just feel all over better. Your nervous system is actually what dictates how your systems are functioning. When your nervous system is functioning better, everything else is functioning better.